A gastric band is considered a reversible procedure. It involves putting a silicone ring around the top of the stomach. So what we do is the procedure is done using keyhole surgery under general anesthetic, and we create a little tunnel around the top of the stomach, place the gastric band in situ, fasten the band so it's clipped around the top of the stomach. The band itself is connected to tubing, which is connected to a port which sits on the front of the tummy of the patient. And the idea is after the healing process, after 6 to 8 weeks, the patient will come to the surgical clinic, be assessed by the surgeon, and then following this, they start having a number of gastric band fills to put fluid into the band through the port, and that helps to make the band tighter around the stomach. The effect of that is to slow the speed that food will pass through the little pouch above the band, through the band, and into the stomach. So what patients will experience with a gastric band is a reduction in the portion size of the food that they're able to eat, and that will give them a feeling of fullness from eating small meals, and that feeling of fullness will last longer between meals. The procedure itself is done as a day case, so patients will come, have the operation in the morning and go home the following day. The recovery typically takes around 2 weeks or so for the wounds to heal up and patients to get back to driving and get back to work. And before the procedure, there will be a preparation of being on a particular liver shrinking diet, 800 calories a day, low carbohydrate, low fat. After the procedure, patients will also need to go on a particular diet to help the healing. So typically, we'll ask patients to do a liquid-only diet for 2 weeks, pureed diet for 2 weeks, soft diet for 2 weeks, and then they start eating normally. Once you've had your gastric band filled, you'll notice that the meals you're able to eat will gradually decrease in size, and typically we'll expect patients to eat from a small side plate, to slow their eating down, to chew the food really well, at least 20 chews per mouthful, and to spend at least 20 minutes eating that meal. So patients will be asked to structure their meals to have a fixed meal pattern of 3 regular meals a day with a couple of snacks in between. And we want patients to focus on the protein-rich and textured foods, because we want foods that will sit above the band and give that feeling of fullness and satiety to last longer between meals, and that will allow the food to be slowly digested and passed into the stomach. And so patients will end up having longer satiety after eating, and they won't feel like snacking and grazing between meals. Typically with the band, patients can expect to lose around 20% of their total body weight. That's just an average figure. And the band is a procedure which you should expect to lose weight slowly and gradually with. And so I often advise patients to expect to lose around 1 to 2 pounds a week and to give time for their weight loss journey. What's really important is that patients make the right food choices. So we want planned, textured foods when they're eating. They shouldn't eat and drink at the same time. And so that should be separated by about 20 minutes. So we often advise patients about the rule of 20s. So no food or drink within 20 minutes of each other, and certainly no drinking with eating, and to chew each mouthful 20 times, and to slow the eating so that they're spending at least 20 minutes eating that meal. And typically patients will have to come to the clinic in the first year on at least 6 to 8 occasions to have the band filled, so that we reach the appropriate amount of fluid in the band for each patient, because this varies depending on the body mass index of the patient, the type of band that we've used, and also the sort of weight loss that patients are expecting to hear. What's absolutely key for patients to understand is that the band isn't a shortcut to losing weight. It requires a lot of hard work on their part to plan their meals, to eat in the right way, to give themselves time to sit down and have that meal, and also to adopt an active and healthy lifestyle, undertaking at least 30 minutes of moderate activity a day. So moderate activity is classified as any activity which helps to raise the pulse rate and helps the patient to get out of breath and to sweat lightly. So that, as long as that's done for 30 minutes a day, patients can expect a fantastic weight loss journey.